Hey there, and welcome to the Hit Like a Girl podcast. My name is Joy Rios, and today my guest is Chandra Osborn, who is the Chief Behavioral Officer at Lirio. At Lirio, they use data and behavioral science to design, optimize, and validate behavior change solutions. So Chandra and I talk about different approaches to supporting people in making healthier choices. And by the end of our conversation, I'm pretty sure we decided that we were going to be friends. Chandra is awesome. I think you're going to love her. So let's hear what she's got to say.
Chandra Osborn, Chief Behavioral Officer at Lirio. And I'm a behavioral scientist by training. I've also have a background in health communication, public health, statistics, kind of an assortment, a collection of tools in the box. Really grateful for the opportunity I have at Lirio to be able to leverage many of those tools.
Well, so what does Lirio do?
So Lirio is a company that specializes in behavior change AI, and that's a new category. It's really not an AI company, it's a behavior change AI company, and the behavior change is core to its DNA. You know, we hear a lot about AI and some of the ways in which it's misused, and it can often be not used in favor of individuals. And I think inherent in behavioral science is the betterment of people, and so bringing that into an algorithm, I think, is a unique opportunity to really do what healthcare big mission is, which is to, serve humans and improve their health.
So does it focus on any specific conditions or disease states, or like what is the type of behavior that we're
Yeah.
hoping to change?
Well, it really boils down to each person, because each person requires different types of healthcare services and different self-care recommendations. And so the beauty of what Lirio is bringing to the healthcare ecosystem are a set of capabilities that can be integrated with what payers are using, what providers are using, what digital therapeutics companies are using to understand what each individual needs to improve their health and support their journey at the end of one level, which I think is a very foreign concept, because healthcare is traditionally very siloed, and you have these, big systems that are focused on specific objectives.
Right.
And the individual gets lost in that sometimes.
Well, so help me understand, is it if I were engaging with Lirio, would it be something that I do as an individual, like I'm going to the app
No,
store, or is it
nope.
like I'm talking with
We
my
are not an
doctor?
app.
Okay.
So what we do is we really are communicating on behalf of a payer or a healthcare system
Okay.
or an employer or another company that we're working with that is really trying to engage and action individuals to take certain clinical recommendations, sort of steps. So clinical guidelines are, you're a certain age, you need a particular cancer screening. We know that there is a gap. Not everybody does that. And there's short-term and downstream effects that are costly to each human being,
Yeah.
and also to the companies that are serving them. So that's where Lirio comes in, is we can help close that gap, because we're understanding people based on what they do and what they don't do and what's in the way, to be able to knock down some of those barriers and really connect and engage each person within the population uniquely.
Okay.
Because that's very much an expectation now. We have so much personalization happening everywhere that the demand for that in healthcare hasn't been high, it's never been higher.
Right. Well, so what have been some of those barriers? What are some of the barriers that are being broken down that get in the way of people accessing or, you know, following through with some of the care that they might need?
Yeah, so there's many, and behavioral scientists have documented this in the scientific literature. Um, very much well documented, but oftentimes that science doesn't get applied to the real world. And so the behavioral scientists at Lirio is really trying to translate and implement that science in a way that can bring value to the healthcare ecosystem. So barriers include, but aren't limited to, misinformation, distrust, cost, affordability, um, sort of not feeling seen or not perceiving that you have a risk of an issue. I don't have a family history of breast cancer or colorectal cancer. Why do I need this? This is too expensive. Um, that is just a handful of them, but there are tons. And so we go through a very lengthy process of identifying what those are and then using active ingredients from behavioral science to overcome that in the communications we send to individuals. And with each communication, we're able to learn what is working and what is not. And that allows us to begin the journey of personalizing to each person, not only about a cancer screening, but about a vaccination, but, taking their medication, really anything that they're expected to do in their unique health journey.
Gotcha. And then I imagine that it also, with their journey, it's also their preferred method of communication. Would you
That's
rather
right.
talk via text, or do you like emails, or would you rather have a phone
And
call?
that may change over
Yeah.
time.
Yeah.
And so we're able to learn that about each person and what they're engaging with and what they're not, and harness that learning to engage with them better the next time around.
Gotcha. So what did you study in order to get into your field?
Yeah, it's a interesting journey. So I'm a social psychologist by training, and really, social psychology is interested in understanding why people do what they do, and then understanding how to influence that, and figuring out how to influence what, decision making, but also getting people to take action. My training has been largely in health for the past 20 years. I've been in the health space. So I've been working with health psychologists since undergrad, really.
Cool.
And it's one of the reasons why my social psychology background has been squarely focused in health for that long.
One of the things that gets me thinking a lot lately has been a little bit trying to understand, maybe just my own behavior, right? Of like, oh, okay, we do things that are comfortable or that we've done before or that we can even imagine. And sometimes it's hard to make a decision, even like about your future. What should I do? What choice should I make if I can't even imagine something different than what I've already experienced? And the psychology of that, I find it to be really interesting because I have to actually tell myself, like, no, like maybe things are even better than you could have ever imagined. And
Mhm.
how to allow for that as an option. I,
That's right. So you're hitting on something that is well known among social psychologists, health psychologists, which is, the best predictor of future behavior is past behavior. And so we know that at Lirio. And so we're able to understand that based on what people have done and what they haven't done, and what they've responded to and what they haven't responded to, and what people like them have responded to and what they haven't responded to better understand each person within the population, to try to move everybody forward. And
and
so
then
we're
how to get
able,
them to make a different choice.
yeah, it's all about meeting people where they are and being able to speak uniquely to them. Health is very personal. And when you have a good relationship with a healthcare provider, that helps,
Yeah.
right? It's hugely important to people's understanding and motivation and ability to execute on health recommendations. But most of how we take care of our health exists be on the walls of that 15-minute visit.
Hmm.
And it really is that we have an ongoing relationship with our own health. And so being a part of that relationship and knowing that there's something out there that stands beside you, I think is a very unique opportunity that Lirio sees and is taking advantage of, which is amazing and exciting and the reason why I'm there.
Well, and it sounds also like they do a really good job of building trust, which I think is a hard thing a very difficult thing to do. Like, how do you get somebody to trust, like, oh, if you're going to make a different choice, you're going to change your behavior, that it's going to be something that ends up being good? You trust that it's in your best interest. Um, I don't know. Can you speak about that a little bit?
It is. It's empathy, it's trust, it's people want to be seen,
Yeah.
and oftentimes there's too many scenarios in life where people are just part of the crowd. And so seeing each individual that's being served from whatever sector in healthcare,
Yeah. That's hard to
I
do.
think it's just a very exciting opportunity. And we've seen that begin to pay off, which is just, I think, very exciting.
That's good. I mean, you also touched on something earlier, like the idea of countering misinformation, or, helping people make better. And I guess in relation to COVID or the vaccine, or do you have any experience or
Yeah.
stories to tell on that? Because I'd be super interested.
Yeah, I can speak to that. So, Lirio is very mission driven, and the people who choose to be a part of our mission are brilliant and um, share a passion and are very motivated to bring something valuable to the world. So, in that spirit, when vaccinations became available, we really wanted to be a part of supporting that become reality where the majority of people choose the vaccine. And so we created a program to promote COVID-19 vaccinations and was able to deliver that program through a healthcare system client in one of the southern states that had, one time, the lowest vaccination rates. And we've been a part of their journey in promoting vaccinations with their patients. Um, and so we've been able to address some of the misinformation. We use multiple channels, text messaging, email, other channels that are available, and we hear replies and we learn from every reply, and it allows us to go back and do better. And we can make changes without compromising any loss of learning from those engagements, and what the algorithm is able to pick up for personalizing for the entire population. So because of not only, the vaccine and being able to overcome some of those barriers. And one of the unique things too about that use case is it dynamically changes over time. The pandemic ebbs and flows and it's not gone. And so having something that can really be responsive to that dynamic context is so critical. And so as people are doing different things, we can pick that up and we can then offer up an additional communication that is more in line with where they are today.
And there's something, I mean, it was really hard at times to not come from a place of like, well, why aren't more people? And just, I guess, coming from a place of judgment of like, how come our
Yeah.
people aren't getting the vaccine? But I think people have had some very legitimate concerns of like what their reasoning is. And, it is kind of for a lot of people, understandably, they're just like not really sure of the right thing. So I'm sure there must have been a lot of different either messages or methodologies or something like of being able to address a myriad of their concerns. Was there anything that stood out to you as maybe like more effective or less effective, or like what were the things that hit on you? Like if somebody had been, really holding out for a really long time and then decided to change their mind, what was it that did it? And I know that that's not going to be the same for everybody, but if there's any that stand out to
Yeah,
you.
it is unique to each person. And so it might help if I help you understand kind of how this works a little bit. Um, so we have a team at Lirio of behavioral designers, and what they're doing is using the um, assortment of active ingredients from the behavioral science literature to overcome some of these cognitive blockers, psychological blockers, contextual blockers that are in the way of people doing what it is they're being asked to do to better their health. And so they are then creating these um, amazing images and copy to make that ingredient come to life. And then what our algorithm and platform does is um, assemble those together so that each communication is a unique recipe. And then that recipe gets sent, and we see what people do. And that's how it begins to learn and personalize over time.
There's somebody, I mean, just like I'm thinking about some members of my own family that are still resisting. And I'm just like, what's the magic answer? Because we've tried all of these different ways and like, think about it from this way. Let's flip it on its head. Like let's address every single one of your concerns. And that the bull has put her foot down. She's like, nope, we're not doing this. And
There will be a segment of people who are just a hard no. They're not in that deliberating space. They're not in the wait and see space. Where, usually when people have strongly dug in their heels, there needs to be a human element to it. It's not a digital communication that will make that come alive.
yeah,
It's sort of everything, the whole kitchen sink, and a lot of high human touch.
we've tried. We're not even there
So
yet.
I
We're just
commend
like,
you. From a behavioral science perspective, you're doing exactly what would be useful.
all right. I'm like, as long as our efforts are, I mean, we're really trying, even as like multiple family members, and it doesn't, we're like, oh, you're going to be the one that gets through. Oh, no, her daughter's going to be the one that gets through to her. Nope. And it's nobody will. At least not yet.
Not yet.
Not yet. Well, I mean, it's good to know that there's efforts that can be made, and it sounds like in the state that had the lowest rates, do you know where they are now?
They are not the lowest, which is great. And we've seen just great progress happening as a result of the work that we're doing with them. I think something to mention too is, health equity in general has been a big theme during the pandemic. And specifically, in health care, we've always known about health disparities. They've always been there, but I think really bubbled to the top in the last 2 years as a major priority. So Lirio lends itself to that because of our personalization. You really are serving each person. It isn't the majority. It isn't the one message for all. It's meeting each person where they are, where the possibility of communicating with them is in the hundreds of possible recipes. And because we use that approach, and this is an approach that I used in my academic career, been doing personalization with high risk, underserved populations for all of my career. What you see is not only, improving behaviors and getting patients to get preventive screenings and preventive care and chronic care and the things that they need to be doing to manage their health, but you're really seeing significant lift among those who are traditionally left behind, who have worse health, worse outcomes, higher healthcare costs, premature. And we see this across the board, wherever we're communicating in different regions of the country, regardless of what we're communicating about, that Lirio is the tide that lifts all boats. And so we see a lot of lift among, Medicare, Medicaid populations, low income populations, racial ethnic minorities. And that's consistent, low educated.
That's got to feel good. I imagine that, like,
I think it's just it works. It works for everyone.
Yeah. Well, can we take a minute to talk about you and your personal journey for a second? I've been loving the answers to this question, and I would like to know what do you think 10-year-old you would think about what you're doing for your career right now? Did she even have, like, was it even a glimmer of something that she could imagine?
Yeah, talking about future selves, right?
Yeah.
No, she didn't imagine that. She, like you, was used to what she was around. And I was raised by a single parent mom who was the daughter of two Marines.
Wow.
So my grandmother was one of the first female Marines in the Marine Corps. She enlisted in 1952, just 4 years after women started to enlist. And at the time, I thought that was my future, that I would become a Marine and I would be the first female commandant of the Marine Corps.
Okay.
And so I just was like, yes, I have trailblazing in my genes. I'm going to, continue to lift that. And really be a torch and see how far I can go. So I think that same spirit has been in my professional journey, for sure, because I tend to find myself in situations where there hasn't been someone like me in the environment. And so I like to trailblaze, and I like to find my way and bring value to the people I'm working with and, the purpose that we're serving.
I can totally relate to that. My grandmother was, I don't know what branch of the Army that she was in, but I know that she worked as a mechanic, like on all of the, like, Army trucks.
I love it.
I know.
That's amazing.
There's just, like, pictures of her in uniform and just, like, under the hood of a car. I'm like, really, Grandma? Okay.
Yeah. You're like, that's my genes. I'm going to own that.
Yeah. And, so she was my mom's mom, and I was raised by a single mom as well. And I think that there's something to be said of, like, do you have sisters? Are there any?
Don't. I'm an only child.
You're an only? Okay. So it's you and your mom, right? Where it's like, okay, if anything needs to get done, we're the ones that have to do it. Like, there's no one to turn around and be like, hey, can you do this for me? You're like, and I get that spirit, because you're just like, it leads very clearly into a path of leadership, ultimately, where you are like, if something is going to get done, or if you want something, you have to go for it. And it creates this drive within you, right?
It really does. Yeah, well said.
Yeah, I've thought about it, and I'm just like, why is it that I'm like this? But it's in part because I think being surrounded by strong women too. And then, for me, I had a little bit of a switch, going into, like, the, life outside of the home, when there's this narrative around, disempowering women, of women not being able to do certain things just because that's the way our culture is. But I was like, but I grew up in a home where we did everything. So it was really hard for me to make the switch of like, no, I can do it all, to no, I'm limited. And I don't know if that makes
Oh,
sense.
that speaks to me so well.
Yeah.
Yeah.
And I was like, oh, why is our society telling me, like, and of course my mom was very encouraging and trying to find ways to like further my education and make sure that, not only that I would be like self-sufficient, but that I was contributing in the world, and like whatever my dreams were, I could go after it. And I'm guessing, don't want to put words in your mouth, but I'm guessing that your mom might have
Yes,
been similar.
absolutely. Yeah. And in that same vein, in my childhood, I was constantly figuring things out. And I think I grew up really quickly because of that,
Yeah.
because we were really partners in navigating the world together.
Mm-hmm.
Um, and so there was never a ceiling. There was always opportunity to grow and problem solve and
Yeah.
be a part of the solution. And so once you leave that and you see all these opportunities and you're like, I want to be a part of that. I want to help solve that problem.
That's great.
Um, yeah, but it's not home in the real world.
No, it's different. It's different out there.
It's different. It's
Yeah.
different.
But so did 10-year-old you have an idea of what she wanted to do? Is it anywhere close to what you're doing?
I knew that I wanted to climb, and I'm first generation college, low income background, um, person of color, even
Yeah.
though it's not visible.
Same. I call myself like I'm white presenting Mexican.
Yes, same. So I'm white, presenting American Samoan. So my
Okay.
dad's American Samoan. Um, oh, so fun. I love that we've connected. I'll just
Yeah.
say that. I know this will be edited out, but it's
No,
just like,
it can
it's
stay.
such a gift to connect with you.
My sister's ex-husband was Samoan, and so I got a lot of like time with the Samoan family too. And man, their culture is really like one of closeness and togetherness. And it was really nice just to be close to it for a while. They're no longer married, but I'm like, oh, the Samoan family, they were so
Yes.
lovely.
Yeah, it's a very close knit culture. Everybody knows everybody.
Mm-hmm.
Um, and it's largely due to that part of me that I ended up in health and healthcare because American Samoans have a significantly higher everything.
Yeah.
Um, and it's one of the reasons why I ended up in diabetes. I was diagnosed with prediabetes when I was 20.
Okay.
And it was just, all my first cousins around me were getting diagnosed with diabetes at a young age. And I've since had those first cousins, and we grew up together. We went to school together, have passed away due to complications of
Oh
diabetes.
no.
So, health equity and health disparities, and seeing those who aren't often seen is
Hmm.
a common thread in my career. Um, just meeting people where they are
I
to
love
improve
that.
their health.
I love that. I love that for a lot of reasons. I mean, so I moved down to Mexico but right before the pandemic. But one thing that I've learned a lot, but one thing that I learned is that a lot of native people to this area are lactose intolerant. And like that's why when you go into a lot of the grocery stores here, there's a lot of the like lactose free milk, or and you can't really, there's not that,
Interesting.
and it's just like a small tiny thing, but apparently it's
Oh,
just like part of 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 their DNA that like native people couldn't consume milk. And so,
Oh.
I mean, I don't know how much that affects their health, but I guess if you're drinking a bunch of milk, it would, right?
Yeah, right. Wow, that's fascinating.
Yeah, I mean, there's a lot of different cultural things going on, but it definitely is highlighted, and you realize, like, oh my gosh, the experience of these people just walking through, the world differently than what maybe what I am used to or what I have experienced. It's just, and even being close to the border, it's so different. 20 miles up the coast versus where I am
Oh,
here.
totally. So I come from San Diego County,
Okay.
and I don't know where exactly you are.
Just north of Rosarito. So south, I
Okay.
mean, but
Yeah.
basically like 20 kilometers south of the border, like right on the coast.
Yeah. So I grew up in Oceanside, which is right
Okay.
outside of Camp Pendleton, hence the Marine Corps background.
Understood. I love
Yeah.
that. Yeah, no, so I grew up in Orange County. My mom and grandmother, they were at the El Toro base
Okay.
there. So yeah, interesting.
Wow. So many parallels.
I know. So where are you based now?
I'm in Nashville.
I love Nashville.
Nashville's
It's
fun.
it's
Yeah.
such a great town. All right. So next question is, what advice, like, imagine you at 23. We had pictured you at 10 and what you're doing with your but you've grown a little bit. Let's imagine you're at 23. Knowing where you are now, what advice would you give to your 23-year-old self?
Wow, such a great question. Um, you know, I think I would give the 23-year-old version of myself um, the advice of just um, developing and owning your voice and not getting small
Hmm.
when the space to feel comfortable in the space, might have instinctually led to you getting smaller.
Yep.
Those are the opportunities to really find your voice and to develop it, hone the skill, sit with it, embrace it, and practice.
I love that. And I think there's a lot of different ways of doing that. I know,
Yes,
like, there's not just one path of like finding your voice. For I like, in the literal sense, my voice is pretty small. My voice is like on the small side, and especially in a group full of people, like, oh my
yeah,
gosh, it takes a minute for me, a lot of effort to, try to like get the attention of everyone in the room. And so it's been such an interesting journey to sort of hone in on, what is an opportunity for me. Turns out one-on-one with no interruptions, being able to just like have a conversation like this is like right up my alley.
I love that.
Yeah. But if you, like, in a totally different setting, if we were around like 100 people, and I would be like, I would need a microphone or a megaphone or something, right? Because my voice in and
Yes.
of itself is not really equipped to command a room that way. But
And I think you're sort of speaking to the essence of the conversation, which is really around how unique each person's voice is and sort of what they need to be successful
yeah,
and being responsive to that um, in a way that leads to betterment for all.
yeah, I agree. And I love that. I love that. Well, basically, the common thread through
Yeah,
our conversation has been that everybody's journey is unique, and
it is.
and that doesn't mean that there's not a way to like guide or get people on the right path. But whatever connection or um, engagement that you have with other folks is really, kind of focusing on the fact that we're all special in our own way.
Right, we're all snowflakes.
Well, Chandra, it's been really nice talking with you. If
Nice
people
talking
want
with you as
to,
well.
yeah, if they want to follow you or work with you or get in touch with you or your organization, where would you lead them? What's the best path for them to do so?
So to get connected with Lirio, you can head to our website at lirio.com. Patrick Hunt would be someone you could reach out to. He fields a lot of the inbound interest in the company and sort of is the triage person. And then to connect with me, I'm in all the places. So
All right.
Twitter, LinkedIn. My handle is Chandra Osborn,
Perfect.
and you can find me on LinkedIn as well.
Well, thank you for spending this time with me. It's been great getting to know
Yeah,
you.
it's been so great connecting with you, and I really hope that we can have a follow-up conversation because I think we hit on something that um, was very impressionable to me, and
Good.
I would love to continue the connection.
Good. Let's make sure we keep in touch for sure.
That sounds great. Thanks so
Sure.
much, Joy. I appreciate your support.